If you have a tattoo or tattoos, just know that this episode is for you, but also tattoos are my number one pet peeve. Let's go.
Welcome to the Healthy Reasonings podcast with Dr. Andre. You are now listening to your number one source for clear, unfiltered conversations about your health and wellness. Join us every Tuesday for success stories, educational topics, and interviews with wellness experts from around the world. You can listen to this podcast on your computer, phone, or any other electronic device that streams podcasts, or download each episode and listen to it on the go. Let's get started with today's episode.
All right, so I didn't mean to give the impression that I'm judging anyone who has a tattoo. Far from it. But I must let you know that over the past 8 years or so, tattoos have readily become my biggest enemy when a patient comes in to see me. And today we're going to talk about why. But before we do, I want to remind you that you're listening to the Healthy Reasonings podcast, which is your number one podcast for clear, unfiltered information about your health and wellness, not about your specific health concerns for the individual watching, but ultimately the aim is to provide you with general knowledge that you can use to improve your health-seeking practices and visit your healthcare practitioner of choice to get help that really matters. I'm Dr. Andre Williams. I'm an integrative oncologist from Jamaica who sees patients worldwide with special interest in cancer and chronic disease. And before we continue, I just want to say, for those of you watching on YouTube or Rumble or any other platform which requires you to subscribe or to follow, I'm really encouraging you to do so. Just take a moment right now and just hit that subscribe or follow button, because it really does make a difference, because the whole aim of this podcast is that it's a labor of love intended to serve the people who listen. And it's my way of getting the information out there as quickly as possible. So if you could subscribe, that would really help me with the algorithm. And even more importantly, if you could like and share, that really helps. So tattoos. Where to begin? Well, we're going to show a little image of a little montage of all the tattoos I've seen over the past several years. And yeah, there are really two main reasons why tattoos are not my best friend. And again, I want to emphasize that I'm not judging anybody who has a tattoo. I understand there are a million reasons why one would get one. But here's the thing about tattoos. Two things that bother me. One, they have an electrical, they cause an electrical problem for the body in many cases. And two is that they cause, I'll use the word, irritative or irritating problem for the body as well. And I'm going to start with the irritation, because as you know, we do vital reflex scans on all our patients, and sometimes I'll meet patients who have multiple tattoos. That's okay by me, because I don't have a problem with the person. But here's what happens with tattoos, and I'm going to tell stories this week again. And so that's going to really help you to understand. But here's a problem with tattoos. One, the presumption is that every tattoo artist uses tattoo ink. What we fail to recognize is that the ink itself, when it's inserted under the skin, ideally would not irritate the body. In other words, you'd hope that the ink would be harmless to the body, kind of like when we were children and we'd mark on our skin with the pen ink. You'd kind of hope that it would be kind of harmless ink like that. However, for obvious reasons, tattoo artists tend to use varying types of ingredients for their ink in order to get brighter stains or more long-lasting stains, for example. And that's not necessarily a good thing, because a lot of these deeper stains, whether more brightly colored or longer lasting, are then reliant on sometimes what we call heavy metals as a part of the ink that's being used to make the tattoo art. Which means you could have had 6 different tattoos done at 6 different places, and the ink being used is made in 6 different ways. And so one of the most common things I'll see is that a patient will come in with several tattoos all over the body. We'll do our vital reflex scan, and only 1 or 2 of those tattoos pose a problem for the body. And we'll talk about electrical further on. But why does it pose a problem? And it poses a problem simply because if the ink is, for example, heavy metal based, or if there's something in it that's irritating the body, sending a signal to the body that, hey, something is not right here. This is a foreign body. This is an invader. This is something that we need to deal with right away. What the body does then is it triggers its protective mechanisms. And in a manner of speaking, what it literally does is try to eat away at the tattoo. So you'll notice in some patients, if you have a tattoo and you're watching, you know what I'm talking about. You'll notice that after a while, the tattoo starts to fade. And sometimes what the patients will tell me is, wow, all the other tattoos I've gotten over the years are older than this one, and they've lasted. They're bright, they're still gorgeous. But this one, it faded within a few months. And immediately my mind tells me, okay, so the body did not like this tattoo in particular, and so it started almost eating away at the pigment or the ink in the tattoo and trying to get rid of it. That's where the issue begins, because in trying to get rid of the tattoo, it has to transport that pigment, or in many cases a heavy metal, down into the bloodstream, and then through the bloodstream around to an organ that is being used for detox. So for example, the liver or the kidneys. And I'm sure you can already see where the problem lies, because you don't want things like heavy metals or metal-based ink or strong industrial types of pigments floating around in the bloodstream, because as they try to exit the body, they're invariably going to cause damage. So that's the kind of irritative part of the tattoos. And I'm going to tell stories about what happened when I met a young lady with that kind of a problem. And so if you notice your tattoo is fading, it's probably an indication that the body is really trying to do something about it, and that's not necessarily a good thing. So what that means is, if I find a patient who has a tattoo that is starting to fade, I need to then provide some amount of support for them to help that ink or pigment not to be accumulated in one area of the body, but to safely exit out and into the toilet, because it's behaving like a toxin. All right, we're going to talk about the electrical problems that tattoos cause right after this break. See you soon.
Life can be overwhelming. Stress, toxins, and the demands of daily life can leave you feeling drained, sluggish, and overwhelmed. What if there was a way to restore your energy and clarity naturally? Introducing the revolutionary coffee enema, an ancient detox practice reimagined for modern wellness. Using the power of organic, high-quality coffee, we help your body to flush out harmful toxins, so your whole body feels refreshed. Coffee enemas are simple, effective, and backed by centuries of medical practice. They promote detoxification from the inside out, without the side effects of harsh chemicals or synthetic treatments, all while gently supporting your liver function and increasing your body's natural energy levels. Step into our serene, relaxing coffee enema room at Teshuvah Wellness. It's a space designed for your ultimate relaxation and rejuvenation. Here, your comfort and privacy is our #1 aim. Try your first coffee enema and experience the gentle power of nature to rejuvenate your body, mind, and spirit. Call us at 876-787-8197 to get started on your wellness journey today. Teshuvah Wellness, return to your best self.
All right, we're back and we're talking about the electrical problems with tattoos. We've told you why the pigment itself is irritant in some cases. And now we're talking about the electrical issues that are caused by tattoos. Now remember I told you when we spoke about the vital reflex scan that we're measuring reflexes across the body. We're picturing the body almost like a circuit or a combination of several circuits forming one big circuit. And because of that, we know that if there is a problem that causes an electrical short circuit, it can affect the area where it is, but it can also affect the wider body. So electrical problems are what we call interference fields in the world of neural therapy. Interference fields are essentially a short circuit. There's a short circuit in the wiring of the body. And tattoos are notorious for that. Why? Because we spoke about the Chinese meridians, or the way how the Chinese map energy flow around the body. And if you look at that diagram that I just showed, you recognize that it looks like a circuit. So that means that when you use a needle to breach the skin, even if it's just beneath the skin, what you're actually doing is you're disrupting that circuit. You're disrupting the circuit board, and you're putting something in the way of the free flow of electricity, for want of a better word, from point A to point B or from point B to point A. And where you disrupt the flow, you create a short circuit. And hey, guess what? Some of those tattoos have metal-based ink as well. So who knows what you're creating there? The voltage changes and that area begins to act like an interference field. Then we need to figure out how we're going to address that. So I want to emphasize that it's really not about how many tattoos you have. It's really not about the size of the tattoos, because I gave an example 2 episodes back about a young lady with a really tiny one on her wrist, and the result that we got when we treated it. But it's really about the location. Another thing that I find more often than not, unfortunately, is that a lot of young ladies, especially those who come to see me for endometriosis or polycystic ovarian syndrome, for some reason they place a tattoo right over the flank, the side of their body, the left side or the right side, down towards the pelvis. And of course that's going to interfere with your reproductive health, because again, a lot of energy flows through that region, and when you put a tattoo right there, it can act like an interference field and worsen an already tricky situation. So the other thing I wanted to say about tattoos, we discussed the 2 main things that I'm irritated about, but here's the interesting thing, is that I find, just my observation, I find that nobody really just gets a tattoo for fun. I know we think that we're doing it for fun, but I'll tell you that in my observation over the past 8 or 9 years, everybody who gets a tattoo gets it at a critical point in their life. Now, they may not think that they did it because of something else, but when we work together, the emotions associated with that time in their life usually come back to the surface. And so I encourage you, if you have a tattoo and you're not sure why you got it, Start thinking about what was happening in your life around the time when you got it. You might find a little clue there. And so I don't subscribe to the idea that it's done for fun. I think there's always a subconscious motivation that many times the patient isn't even aware of. And that's why they got the tattoo. So we're going to take another quick break, and then I'm going to come back and tell you some really cool stories about experiences that I've had helping people with their tattoos. We'll be right back.
Healthy Reasoners. You asked and we listened. After enjoying today's episode, you can now send Dr. Andre your comments via WhatsApp. That's right, WhatsApp your comments or voice messages to us at 1-876-405-7831. In fact, take a moment to send us a WhatsApp right now. If it's really good, Dr. Andre will read it in the next episode. Once again, that's 1-876-405-7831. Send us your message now. We can't wait to hear from you.
All right, we're back. And I mean, I have story after story about tattoos. I'm going to tell you the most exciting ones. So the very first one I saw had to do a lot with the irritative features of tattoos. It was a young lady who came to see me several years ago because she had developed a condition called interstitial cystitis. Interstitial cystitis really is a condition where there is irritation of the bladder to the point where the patient almost always feels like they're having a UTI, urinary tract infection, and yet the tests almost always show that there's no germs there. So the suspicion is that there is some sort of inflammation happening in the patient's bladder or urinary tract, and but there's no bacteria detected. And I think we've always kind of known that there's something causing that inflammation or irritation of the bladder lining, which leads to that sensation of always needing to go to the restroom. So this young lady would go to the restroom 7, 8, 9 times a day, sometimes more. Even just in the space of the short visit she would have with me, she would need to go to the bathroom a couple times during the visit. Young lady, she had had a small child, and she really was just having a nightmare with this experience. Because just imagine always feeling like you're having a UTI. That's it's like hell on earth. So she came to see me, and luckily for her and me, at that time I was doing my vital reflex scans, and so I just did what I normally do, which is I took nothing for granted. I just decided to scan this young lady. And when I scanned her, I found that she had a tattoo on her lower back. You know, in the early 2000s or so, that was a popular thing to do. And so she had a tattoo there, and it was behaving like a short circuit. But I also knew that the tattoo looked very faded. And so I said to myself, wow, this is a double whammy, because this is an irritative thing where the body is trying to destroy this thing. It's pulling the pigment out into the bloodstream. And based on what I could see, it was trying to clear the pigment in the tattoo through the urinary system. So when it got to the bladder, the pigment was so irritative to the bladder that it was causing damage and inflammation to the lining. So on the one hand, I had to make sure that I protected her body from trying to carry the pigment through the bloodstream and try to help the body to get it out another way into the stool, ideally. So we put that in place. But at the same time, I recognized that when I attempted to treat the tattoo itself using neural therapy, we discussed it earlier in another episode, what would happen is the body would become even more energized and keen on getting rid of the tattoo itself. So I had to gently balance the process of helping her to clear the ink and also gently stimulating the body to correct that short circuit and ultimately clear the tattoo from the skin. The good news is we had an excellent experience. We had to do quite a few sessions of treatment, but in a few weeks, this young lady had no longer, she started going to the restroom like 2 or 3 times for the day, which many would argue is normal. And ultimately, what happened is not only did she improve in terms of her symptoms, but she was always having a lot of pain in the lower back as well as the pelvic region anyway, and that also subsided. So that was my first major experience with tattoos, and it was a double whammy because both issues were there. Now, in her case, I didn't really think about the emotional connection, but as I grew in my career, I started to notice it more and more. I'll take another case, which is a lady from another country. She was middle-aged, and she came to see me because she was having a lot of brain fog and mood swings and just generally not feeling like herself. And she heard about me and thought that she would come and be treated by me before going back to her home country. She came to see me, and I outlined everything that needed to be done for her. Did the vital reflex scan, examined her, told her what I thought was going to happen. I saw the tattoos and knew there were going to be drama. She had one over her right shoulder and another one, I believe, on the abdomen somewhere, and both of them were short circuits. So we decided to treat them both, but instinctively, I decided to start with the one on the abdomen first, and then the one on the shoulder. Sometimes I just instinctively get a sense of what the body would prefer. So most times I'm correct, thankfully. Because I always say you have to treat the body like your neighbor's dog that you're meeting for the first time. Everybody always says, oh, he's a friendly dog, he won't bite. But you know that in order to approach the dog, you can't just make a sudden movement or an aggressive stretch towards them. You have to gently get their confidence until they're willing for you to pat them on the head or something. And it's the same way with the human body. We have to gently assess where it will need help and not make any sudden shifts in its equilibrium if we're going to get the best results. Say all of that to say, with this lady, I did what I thought was going to be the less jarring tattoo first. I asked her how she felt, and she said, boy, I felt like this nice calming effect came over me. And I said, okay, I know we did. That was the right move. Is it okay if I do the one on the right shoulder now? And she said, yes. So, if memory serves me right, this tattoo said something like father. And I should have known. But I went ahead and did my injection neurotherapy, and all of a sudden the lady screams out and pretty much just launches into me with a stream of bad words. She became very angry, shouting at me, verbally abusive, which was not her demeanor when she came in. It wasn't how I hadn't gotten an inkling at all that was the kind of person she could be. A very sweet lady. And of course, I didn't take it personally. I just simply said, what's happening? You seem very upset. And she burst into tears. So I, as best as I could, I comforted her and said, hey, let me know when you want to talk about it. And she said, well, I'm just very upset with you right now. And I said, well, I haven't really done anything to you, so why are you upset? And she couldn't understand or explain why she felt so angry towards me. So I said, hey, tell me a little bit about this tattoo and what it means. When did you get it? And she said, it doesn't mean anything. However, I got it immediately after I found out that my father had died. And I said, and what did your father mean to you? And she said, well, I'd never really known him that well, and so I'd always had this kind of resentment towards him. And I had hoped that one day I'd be able to have a discussion with him to let him know how I felt, but then he died. And I was just so angry with him for dying before I could have that conversation with him. And of course, kind of clicked to me at that point, okay, as I suspected, the lady was not upset with me, rather she was upset with her father. And subsequently, when I saw her for her review, I mean, she looked like a totally different person. Her skin was glowing, her whole body was just radiant. And I said, "You're looking so great." And she said, "Yes, I went home and did some introspection about what was happening, and I feel a lot better." So that one was a combination of interference field or short circuit, as well as emotions related to the tattoo. And now for the coolest one for me is a 21-year-old young man. He came to see me because he had, a few months before coming to see me, had developed severe episodes of severe left-sided chest pain. Remember, he's 21 years old and he's having severe chest pain. The episodes would last for several minutes, and by the time he came to see me, he had seen a gastroenterologist and done tests to see if anything was wrong with his esophagus. He had done several heart tests, including an echocardiogram, ECG, you name it, he had done it. Remember, he's 21. He has no history of heart disease, and his family has no history of heart disease. And, they had done almost every test you could imagine would be helpful for chest pain. They brought him to see me, told me the story, and then I said, "Okay, let's get you onto the bed. Please remove your shirt." And he removes his shirt, and what do I see? A huge tattoo right over his chest, right over where his heart would be. And I said to him, "Well, did anybody ever comment on the fact that you have this huge tattoo right there?" And they said, no, it's just something that he got. And I said, "Okay, well, I think that's where the problem lies." And everybody laughs. "Oh, come on, it can't be that." I said, "Well, let's treat it and let's see what happens." So, of course, I did a vital reflex scan, confirmed that the tattoo was in fact behaving like a short circuit. And of course, it's sitting right over the heart, and it's sitting right over the esophagus. Everything in this area is being kind of like interfered with. And, the heart is an electrical organ. You don't want to mess with its electricity. No problem. We do the neurotherapy injections for him. And, while he's in the office, he says he feels something shift in how his body feels. Suffice it to say that he never had chest pain again after that date. I saw him the other day and actually didn't recognize him. And he said, "Doc, thank you so much." I said, "How is everything?" And he said, "I'm fine. I'm perfectly fine." So the question becomes then, how many cases of how many situations have we as doctors missed where the patient has these symptoms, we do all the necessary tests that we're trained to do, but yet neglect the fact that maybe the tattoo itself that was sitting right there in front of us on the patient's skin was actually the cause of the patient's problems. So, I could tell you story after story, but I think 3 is enough, and I've told you 3 really good ones. The other ones I could tell are pretty much the same principle. Most of the time it's an emotion that's brought up during the treatment or a little bit after. And most of the patients will mention that their whole body feels so much lighter, and a lot of the brain fog seems to clear when we help these patients with their tattoos. So in summary, if you have a tattoo, no judgment. However, if you have a tattoo and you have strange, unexplained symptoms, you might want to get in touch with a company called Teshuva Wellness or a healthcare practitioner that you trust in your area and let's see if maybe we can do some work on the tattoo for you if it's the problem, and see if you don't feel better thereafter. I want to remind you to subscribe, like, and share if you enjoyed this episode. It really does help me to help you. And the truth is, I really want to help more than just the people listening at this time. I would love if each of you could share this video with at least 5 of your friends, or if you want to share with 10, that's fine too. But the quicker we can get this information to others is the more meaningful and impact we will have as healthy reasoners. So it's not about me, it's really about trying to get this information to as many people as possible so that we can have a shift in the culture of how we seek health or health-seeking behaviors, a greater understanding at the baseline of what the body was built to do, and how it can heal even when the situation looks unfavorable. Another late night episode. It's like 12:30 in the morning, but I was up doing some work anyway. So I hope you enjoyed it, and enjoy the episodes to come as well. See you soon.
Thank you for listening to another episode of the Healthy Reasonings podcast. Remember to subscribe to this podcast so you can be updated as soon as new episodes are ready. If you have a question, send us a voice note on WhatsApp or a WhatsApp message. The WhatsApp number is 1-876-405-7831. For more information or to become a sponsor, please email wellnessdocjamaica@gmail.com. See you soon.